Is This Normal, Doc? A podcast sponsored by Tanner Clinic.
Welcome back to another episode of Is This Normal, Doc? The podcast where we talk about what's normal and what's not with the expertise of our Tanner Clinic providers. As always, I am your host, Hope, and Tara's joining me as my co-host. If you missed part 1, I would suggest going back and rewatching that. We're doing a continuation on our mini-series on food allergies. We learned a lot in part 1, so I highly recommend you go back and watch that. This is part 2. We have the same guest with us, Katherine Jenkins. She's in our allergy department here at Tanner Clinic. So let's get started on part 2.
Perfect.
Shall we?
I think that goes right into my question. So should I go and see an actual allergist, or can my family medicine doctor help me with my allergies?
This is an excellent question. It's important that you go and see an allergist. While family medicine doctors are wonderful and they're kind of the front line in seeing people, a lot of times people will go there that the primary care will recognize what's wrong and refer, which is absolutely appropriate. But if you're pretty sure that your child has an allergy, or you even just want to understand what's happening, making an appointment with an allergy department is important. The biggest reason why someone should see an allergist versus just their primary care is because, again, while they're doing their best, there's a lot of misinformation or mistesting that happens. So people will draw labs to a whole bunch of foods, and then they'll say avoid because there's low-lying positive to those, but the patient has been tolerating them this whole time. So instead of just the offending food that they're not certain about, they're told they're allergic to a lot of things. So by the time they get to us, it's kind of the same processes and sensitivities. I'm saying it. Sensitivities and intolerances.
If you watch part 1, I kept saying insensitivities.
Now she's got it stuck in my head.
I got it stuck in her
So
head.
intolerance, sensitivity.
Yes.
You're just trying to mix the words.
Right.
Sure.
Again, there's just a lot of convoluted information. And so people come and they've been avoiding things for a long time. In allergy, we never want anyone to avoid a food that they tolerate well. We always want to keep foods in diets. We will only pull out foods that we think are the offending factor for maybe eczema or other symptoms. And for food allergy, for sure, we cut those foods out.
Is it possible for a child who develops a food allergy, at a young age, can they ever grow out of a food allergy?
Definitely. So I usually will say that food allergies can be outgrown in the early years of life, so 0 to maybe 6 years old. It's uncommon for it to happen beyond that. Maybe occasionally it does, but usually it's those early years of life. The reason for that is that when you are, 0 to 5, your growth trajectory is huge, right? You start as this little baby and then you grow into this full person by the time you're entering kindergarten, first grade. So your immune system is rapidly changing, and then it's still changing. It's not that it's not, but the rate at which it's doing that is less. And so, yes, we see that. Most commonly, milk and egg are the ones that are outgrown more so than nuts and other foods. But yes, it can happen. Does it happen often? Not as much.
I can imagine people probably are also scared to try those foods if they knew that they were allergic. So
that's important to note that we always want early introduction. So there's lots of different thought processes about that. And I have 3 kids. My oldest is almost 18. My second is 15. And then I have a 10-year-old. And with each one of those children that I've had, the thought process on introducing allergenic foods has been different. Now everyone is kind of in agreement that early, as soon as possible, is important. So early introduction. So I usually will tell parents, by the time their child is 6 months old, if you can start introducing the most allergenic foods, do it. Milk.
That's definitely new information.
It was totally different before. There's straight cow's milk. As far as drinking a bottle of that, we avoid until usually 1 year of age, just because babies' stomachs have a hard time breaking it down. But there's milk-based formula or yogurts or cheeses, and that's great. Introduce that. All of that is milk products. Eggs, you can make, baked goods that a little piece a baby can eat. Usually by 6 months of age, a baby can sit in a bumbo or some kind of high chair, be upright enough to do little amounts of foods. Yeah. Peanut butter, there's peanut powder. You can make a peanut slurry to just try to introduce it as early as possible, because we don't want the body, if you wait too long, then suddenly the body will start to recognize it as foreign because it hasn't had it in that time frame. So while I get that it can be confusing, the consensus now across the board is early as much as possible within reason.
So what about honey? Because that was one that I remember being don't give your babies.
Honey, you still wait until age 1. That's a botulism thing.
Okay.
So you wait until age 1 for that. But outside of, again, honey is the one I usually mention, and straight cow's milk, everything else is go for it.
Crazy.
Within appropriateness, right? Like wait till a baby can mouth something. But like yogurt melts are super important. They have little puffs, peanut puffs called Bamba or Bomba puffs. They're peanut coated like a Cheeto, but they melt really quickly. And then, make eggs. You can do eggs and baked goods. Then you can go to scrambled eggs. You can do other nuts that are ground into flour. There's lots of ways you can introduce it, but that's the most important thing. And if you have a history of food allergy in your family and you're nervous, we will often have people come in. They'll tell me that they're nervous to introduce to a new baby because brother or dad has an allergy. And so we will do that skin prick testing to the foods that we have a panel called the top 10 foods. So they're the kind of the most allergenic foods. And we will do that testing. And then if it's negative, then we give them the option to do that early feeding in our office just in case, or send them home so that they have a little more peace of mind.
All right. So what are the treatments or cures for food allergies?
Treatment, I would say you have kind of two options. Strict avoidance, which is what most people do. But here at Tanner Clinic, we offer something called OIT, which stands for oral immunotherapy. It's a program where we will slowly desensitize someone to their food allergies and get them to the point where they can eat freely as long as they maintain a daily dose. So that's kind of the treatment. If you don't want to do treatment, which is fine, treatment is optional and it definitely needs to be something that your family wants to do and is committed to, then strict avoidance and carrying an EpiPen is the only other option.
Which can kind of be hard because you eventually send your kids to school and so you don't have that
The control. Yep.
So what would you recommend when you are sending your kids to school?
How to keep them safe.
Exactly.
So EpiPen at all times. Most schools, we do a lot of paperwork in August. Most schools, when children are younger, they'll have it in the office. The problem in Utah, at least, is there are not nurses in every school every day.
Correct.
Most of the time, there's one nurse for a grouping of schools. So then it's usually the poor office staff. They're amazing. They have to deal with a lot of things that they didn't sign up for, a lot of medical things. And so it's important for me that as early as you think your child can understand, teaching them how to use it. And I recommend every year that parents go into their teacher, discuss what the food allergy is, and then show them how to use the EpiPen. Right. So that way, if it is in the office and, showing the office workers as well, then they can have some peace of mind that that's there. I also recommend people have liquid antihistamines there so that they can give that kind of first line.
One other thing maybe that they need to also check, I heard that EpiPens expire. Is that true?
It's true. Usually EpiPens are good for a year. Sometimes a few years ago, we had a random batch of epinephrine kind of across the valley that parents got and it expired 3 months later, 6 months later. So it's always important when you fill an epinephrine prescription as a parent, when you're getting it, or if it's for yourself, that you look on that epinephrine and you see when it expires. Then you make a note of that. For schools, they require paperwork every year and new epinephrine every year. So it is good to know. If all you have is expired epinephrine, use it. But it's important to have up to date.
Without actually, obviously we don't have an EpiPen here, but can you kind of explain how to use an EpiPen for people who are curious about that?
Yep, there's several different kinds of epinephrine. The most common or the ones people are most familiar with are EpiPen brand. And then there's one called Auvi-Q. There's other like Adrenaclick or generic epinephrine. I like those less because their mechanism of action, the way it comes, is less stable. EpiPens and Auvi-Qs have a great device that they use. Ultimately, what you're doing is pulling off. There's always a safety cap. So you're pulling the safety cap off and then you just, however you're holding it, you need to make sure that the needle is pointed down. And with a pen especially, it's not a clicky pen. So you need to hold it like this because if you do that, I've had parents put it through their thumbs before because they've gone to do it and it's been backwards. So the biggest thing is, especially if you or a loved one has a food allergy, knowing what kind of device they have, because sometimes people will change year to year depending on what their insurance covers. So you need to make sure that everyone knows how to use it, train people appropriately, go through it. There's usually a trainer in the box that it comes in, so it will walk you through it. Auvi-Q is really nice because it's flat and it actually talks to you. So once you pull off the safety, it will talk you through how to use it. But in general, using an EpiPen, or epinephrine of any kind, you pull off the safety, you hold it, you put it into the thigh, And you don't have to take clothes off. It goes right through jeans or any other kind of clothing. You would stick it in there just kind of really pretty quick, not crazy firm, but firm enough so that it can go through there. You hold it there for a few seconds so that the epinephrine can get into the tissue and muscle, and then you pull it out.
Yes.
And the reason why it's important that people train, just like anything else, is when you're in the issue and you're having an adrenaline dump because you're stressed out, you need to be confident that you know how to do it and take the time to take a deep breath so that you do it correctly. Because if you do it backwards, EpiPens come in a 2-pack. The reason they come in a 2-pack is in case you have a device malfunction, but also if you have a second or a biphasic reaction. So say I give it to you because you've had a reaction and then 15 minutes later, your reaction ramps up again. That is less common, but you need to have a second dose to do it. Mm-hmm. So a lot of times people will get epinephrine and they'll be like, great, I got 2. There's one for grandma and there's one for school. They're meant to be kept together. So if you need multiple sets, that's fine. We can send you that. But it's important that you know how to use it. So if it comes down to that, you're using it correctly. The reason why I like EpiPen and AviQ is because the needles will retract. In other devices, often the needles will stay out. So then you just have to be careful. There is one other new epinephrine on the market, though.
Tell us about it.
It's called Neffy, and it's a nasal spray. So it works a lot like the drug blocker. You put it in, like Narcan, is what I'm talking about, but you use it in the nose. So it's an intranasal spray. So instead of having a needle, because we have a lot of people who don't use Epi when they should because they're afraid of either using the needle on themselves or they're afraid for hurting their kid. The problem with that is if you delay epinephrine and you need it, that can be life-ending. If you accidentally give epinephrine to somebody who doesn't need it, if you're not sure, they'll be hyped up for a while and then they'll be fine. So I usually will tell people, give it. If at any point you're concerned, give it. It's better that you give it and they didn't need it than you don't give it and they did need it. Mm-hmm. With Neffy, that's the nasal epinephrine, it helps people be a little more confident because they don't have to do the needle, but you just need to make sure you know how to use it. Mm-hmm. So I used it a couple weeks ago on someone who was in anaphylaxis. You hold it, you stick it in the nostril, and then you push. You kind of have to push firmly. It has to go past the safety that's built in, and then it sprays in the nose. They do not sniff. They just go there, and it goes into the membranes and then starts working. And it also comes as a 2-pack. So if you need to use it again, if you need a second dose, then you put it in the same nostril and do it again. So that's a nice option for people. It's newer to the market, but it's a nice option. And again, I have used it. I have it for my own children that have food allergy. I have epinephrine also. Because this is my job, so I'm comfortable doing all of that. But I do have Neffy for my boys as well.
Yeah, is it pretty accessible for people?
It is accessible. Because it's newer, it's less covered by insurance. So they do have. It's usually like $150 if your insurance doesn't cover it, and you just pay that straight out of pocket. They do have a payment program where you can pay like $50 a month if it's hard for you to afford. So my insurance didn't cover it, so I just paid out of pocket for it, and I have it.
And how does the cost compare to the EpiPens?
Pretty similar.
Yeah.
It really just depends on your insurance coverage, like your pharmacy plan. Some people, it will cover completely any kind. Most of the time, there is some kind of bigger copay on it. It's really unfortunate. I feel bad for allergy families, especially if they have multiple children or with allergies. It can be expensive, but it's literally life-saving medication. Right. It's vital. Yeah. So there are cheaper options, and I'd rather people have the cheaper option with the less good device than none at all.
Yeah. It would get expensive if you have multiple kids and they have to have one at school and one at home. Then
and sometimes I get nervous because patients will come in, and I get it. I'm not judging, but they'll have like one set for 3 kids. And what if something happens beyond that? That just makes me nervous. So it really is important that every person has a set of devices for themselves. Also, there are different dosages. So depending on how much you weigh, that's what dose you're given. So that's important too. So sharing is not the greatest option.
Could it be like really dangerous if you give someone too high of a dose for them?
Too high, we don't usually worry about. Years ago, when they kind of first started doing this, they used higher doses than we do now. So, and sometimes, again, you have to get multiple EPI, so you are getting higher doses, but we want to make sure like a baby isn't getting an adult dose or vice versa. We also want to make sure if you have a kid that had a junior, which is a smaller dose, and then they have grown since then, they need an adult dose. That's not going to be enough to shut something down. It will take the edge off, but we need to make sure that they're getting the medication that is safe and appropriate for their body.
So how much do they weigh when they start qualifying for an adult dose?
So usually around 60 pounds. So some people, when they're in the 50 range. So I usually will err on the side of a little bit higher because I'd rather have someone had a little more than not enough.
Yeah.
So usually between 50 and 60 pounds.
So not really an adult.
Not really an adult,
Yeah.
but it's an adult dose.
Right.
But it can make a difference. Some of the pens, so AviQ has a small dose, a 0.1, then they have a 0.15, then they have a 0.3. So again, it's important to be seeing your doctor, your allergist regularly, and getting those updated so that as your child grows, you're getting the appropriate amount.
So one of the questions that we got from someone on our social media, and I think this goes along with like people who choose avoidance as their, treatment option, but how do you avoid like hidden allergens in your food? Is there any tips that you can give for people?
Absolutely. The biggest thing that you need to do is make sure you are reading labels. So there are often times where people will come in, they have a known food allergy, let's say peanut. Yeah. And they come in and say, well, I gave them a cookie from a certain place that I didn't think had any allergies, and they had a full-blown reaction. And then typically there's a certain store that I'm not going to name, but there are a lot of products. It's not that they're hidden. It's that the nutrition label, the writing is like this big, like you need a magnifying glass to read it. But a lot of times, especially in diet culture now, we're replacing a lot of things with nut products to make it healthier. And that's great, but you really need to read labels. Also, you need to understand that cross-contamination can happen. So it can happen in your own house, but more often than not, if people are eating out, you can have cross-contamination, even though restaurants will do their best to be allergy-free. So reading your labels, knowing what's in your food. Most of the time I tell people you need to make everything from home. Yeah. And then be asking. So another thing that happens is a kid will go to a birthday party and they will know, the parent, they're not trying to do any harm, but the person whose birthday it is, parent, is like, oh, this is whatever. And in either cooking the food or they forgot and grabbed something extra, or someone brought something else and someone will accidentally get a bite of that allergen or eat something. That can be dangerous. So really talking to people and knowing what you're putting in your kid's mouth is important. Yeah. And it's hard. I know, I'm not saying that it's not hard. These moms and dads have full-time jobs doing this. It's a lot. But if you start doing it really well when you're young and you avoid foods that may contain, maybe cross-contaminated with, you're set up for a better life kind of moving forward when you get used to doing that. Yeah. But that's also why treatment is a great option if you feel like it's up for you.
So if you've done the treatment or if you choose not to do the treatment, what are some good substitutes that they can use, for like milk or eggs, especially if they love ice cream? What are some of your favorite substitutes?
So I really like, again, I don't do a lot of milk. I don't do any straight milk usually. I do milk products. I do better with that, but I still try to avoid. But I have found personally that I think coconut products are really great. Coconut as long as I don't have a coconut allergy, which is less common but does happen, coconut products are really similar texture like milk. So, and it doesn't taste like coconut generally. It just gives that same texture and almost maybe tastes like milk. So there's coconut ice cream, there's coconut substitutes. A lot of times people will use cashew. So they'll do you can make a cashew sour cream just by blending cashews with a little bit of liquid. But again, if you have a nut allergy, you've got to be careful. So oat milk is a great option as long as you're not allergic to oats. A lot of people who have a dairy allergy will use almond milk, rice milk, coconut milk. There are options there. And luckily, actually nowadays, because diet culture is what it is, there are lots more options than there used to be, which is fantastic. Again, you just need to be reading labels and understand what you're using. Also, labels can change over time. So there are things that we have used. I've been doing this for 11 years now. And in the 11 years, there are products that we have used during all of that time, but we have checked labels over time and what they have said on the labels has changed. I've even called manufacturers of big food companies that everybody would know, and they've admitted that they haven't changed their manufacturing. They just are worried about litigation, and so they put stuff on labels. Also, protein amounts and things have changed. So certain almond milk used to contain a lot of protein, which is good. You want protein in that. But then they kind of took that out, I think, to be cheaper. And so you just need to kind of be aware of looking at labels and being sure that you know what you're eating or drinking.
Is there such thing as a good non-animal product cheese?
I don't think
so.
No.
So I tried a vegan cheese a couple of years ago. I was really struggling and I couldn't get back past the smell. I will say that kids, teenagers, adults who have always been on vegan cheese love it. In fact, when they do food treatment, they often do not like regular cheese. And we're all affronted by that because everybody loves cheese. If you're going from having milk products because you have a sensitivity and you take it out of your diet, I don't think there's any good cheese.
Just for like lifestyle reasons, I've gone off of as much dairy and gluten as I can. So I have resorted to like a lot of coconut products. They have like ice cream. When you're like really craving ice cream, they have that. So that's really good.
No, coconut ice cream tastes very similar.
But the one thing I could never find was vegan cheese.
Same. Yeah. I kind of did the same thing because I was having so many issues. And I was like, well, I'd rather not have cheese ever than eat this. It kind of smelled like stinky feet. But again, if you have a young child, a baby or a toddler young child, and that's all they know, great. Early introduction of anything, someone learns and it shapes their palate. Your taste buds are changing all the time. So your palate can shift, but in general, vegan cheese, not the best.
Disgusting.
Yeah.
So what advice can you give for families with food allergies that are going to restaurants or traveling? What kind of things can they prepare for?
So that's really tricky. Always, if possible, I want people to prepare their own food just because, again, you can do your best and still get some cross contamination that happens there. Yeah. The number one thing I would say, if you are going to be eating out somewhere, then I would tell them first and foremost right up front that you have a peanut allergy. Try to pick restaurants, look through their menu. Nowadays, a lot of restaurants will have allergy information listed on there. So make sure that you're looking at that ahead of time. Then when you go, tell your waiter or the frontline staff that you have an allergy. And a lot of places are good at that. But when you think of line cooking, you have one person a lot of times cooking many things at a time, and spoons or cutlery utensils are shared. That's where your cross-contamination comes from. So they can usually say, like, this item does not contain this allergen, but was it cooked on the same surface as something else? Was there some cross-contamination there? It can happen. So do your best and then have your medications on hand. So have some liquid Zyrtec available, have an EpiPen available just in case, but where possible, bring your own food.
And I think it's nice now people can get like Airbnbs instead of like staying at a hotel. So you could just go to the store, get groceries, and cook your own food there. So I think that's a nice newer thing option that people have.
Yeah. You can also, if you're flying, you can request a peanut-free flight. So they don't really serve peanuts on flights anymore. If you fly and you've noticed that, it used to be you got your peanuts and your drink, and that was what you got. Now they have other options. So very rarely anymore do I get actual peanuts. But it's important to tell them if that's a problem, because you can have some people who have airborne allergens. So if I was peanut allergic and you were eating peanuts, potentially I could still have a reaction just by breathing it in. Not common, but it does happen.
Yeah. I almost killed one of my brides doing that. Not almost killed. Well, so I always bring treats, for our shoot or whatever. And I was like, hey, do you guys need a little snack? And I almost opened the bag and they're like, wait, what is that? And I'm like, peanuts. They're like, don't open that. So I almost opened peanuts with someone that, like, when she takes flight, she has to make sure that there's no peanuts and severe allergy.
Like, you don't always know.
Right.
And you're doing your best. Also, it's kind of a contraindication, right? We tell people to introduce early and as much as possible, but then if you have an allergy, you have to avoid. And so even parents, like, we have a kid that's allergic and one that's not. How do we do both those things? How do we introduce food into the one's diet, but how do we keep it strictly away from the other? In a household, I usually will say have a cupboard up high that contains your allergenic food. So if we're talking peanuts, put all your peanut butter and peanut products up in that cupboard, potentially one that could lock, because some people, I don't know about you, but my youngest was a climber. Yeah. And so when you have a kid that can climb and get into that, you want to be careful. And then I'll say, make a surface of your kitchen. So in my kitchen, next to my oven, so between my oven and my fridge, I have a stretch of counter. If I had an allergic kid, I would prep all of their food there and no one else's food there. So I always knew that was clean. And then have like a separate set of utensils, but ultimately just making sure that you're washing it. In a restaurant, when you're traveling, you don't have that guarantee. So the other thing I would say that people don't think about, my example is usually with babies. I don't know about you when you had kids, but most moms like to hold and snuggle their baby, kiss them on the mouth. If you have a child that's peanut allergic and you've eaten something that contains peanut and you kiss them, you can make them have a reaction because you're transferring what you've had onto them. We have moms that come in and they'll say, I didn't know, and I kissed them on the cheek and they hived up right where that was. Or I tell teenagers when they're starting to date and kiss, you've got to tell
They all
your
have,
partner.
just tell them they all have peanut allergies.
Right?
I'm sorry. Until
Right,
you
fill it out.
You had peanuts.
I actually had 2 patients go on a date. Like they knew I was their provider, but they went on a date. They just happened to go to the same school. And it was nice because they both had allergies. And so they just carried their little EpiPens around and they were able to have a great
I feel
date.
like there's going to be an app for this. We
Right?
can match
Swipe
people
right
up.
if you have an
peanut.
allergy.
They definitely need to add that to the dating app. Like,
Right.
do you have food allergies?
But there are those are the small things that people don't really consider.
Right.
It's another reason why it's important to go to an allergy clinic because there's all sorts of tips and tricks along the way that people need to know. And it kind of can depend on age. It can be across the board, but there are things that I try to tell age specific that someone may run into in addition to just general information.
So I need another tip. When I have friends that have food allergies, I'm always looking at the back of the package, right? And it says, may contain this thing or manufactured in a facility. So tell me more about what I need to know with the difference.
So tricky. So this is the thing that I hate most about kind of where our world has gone to, because most companies now, in order to avoid litigation of any kind, will put that on packaging, even if it's not the case. So there was a company I called. We used their food product in our food OIT program. And it had always said one certain thing on their package. And then we noticed several years ago that had changed. And so I called the company and I said, I noticed that you've had a change on your package information.
Right.
Can you tell me if you changed your manufacturing? And it's quite a large company, one that everybody would know. And they said, actually, no. So most factories have like a compound, right? So it's a big plot of land and they manufacture one thing here and one thing here and one thing here and one thing here in separate complete buildings. Or in a building, they have, so I have a friend who used to own a candy manufacturing company. And so you go in and there's huge machines that do it, but in each separate room, a different machine was for something else. Mm-hmm. Yeah. And so when they put that on there, most of the time now it's because they make products and some of their products may contain their allergens.
But not even the same building.
Mm-hmm. Yeah. So, but sometimes they will use the same equipment. And even though there's usually a pretty strict cleaning requirement for that, there's also, a certain number of remnants of things like bugs or other things that can be in your food. That's normal.
Yeah.
And so even though you're vigorously cleaning something, if someone makes a mistake, there can be cross-contamination there. Now, if you're talking a big batch of something, the likelihood is going to be small. But you do have to keep in mind that there may be a piece of something stuck in a gear of some kind of blender. And when they're making something else on that same machinery, then it goes in. Most of the time in big corporations, that's not the case, but it can happen.
Yeah.
Also, now they're better at packaging. So they'll say, this is a chocolate bar and it contains milk, soy, maybe some wheat. Mm-hmm. So it's important to read that for sure. But if you ever question, I tell people to just avoid.
So something that we've mentioned a lot throughout this episode is OIT. Mm-hmm. So I'm curious to know, what is OIT and how does it work?
Perfect. I love OIT. It's a really great program and option for people with food allergy. OIT stands for oral immunotherapy. It's a program that we do specifically with foods and people with food allergens. We can treat basically anything that you have, but we most commonly do the top foods. So milk, egg, wheat, soy, peanut, tree nut. I've done green pea. We've done shrimp. We've done chickpea. We can kind of do treatment to any of those things, but it's a desensitization program where we take a small amount of the product that you're allergic to, and it's the protein in that product that you're allergic to. So we take that protein amount and we go down to tiny, tiny microdoses, and we slowly introduce those microdoses, and over a period of time, you start to become desensitized to that. So we're not making you not allergic, we're just desensitizing you to it. Sometimes you can become non-allergic, and it's easier if we start when someone is younger. So the younger you are and that immune system is kind of more elastic and growing at a faster pace, the more likely you are to have permanent desensitization as you go on. Or if you have a young kid that you're not sure whether or not they'll outgrow the allergy, they're kind of on the border, If you start them young, we can typically make them non-allergic. But in general, it's a desensitization program.
So how often do they come in and how long does it take?
So I usually tell people the program takes 6 to 8 months. That's because we need to account for illnesses, holidays, trips that people may go on, things that may happen that make it so that they can't come in for their appointments. They're weekly appointments that last about an hour every time someone comes, and it's weekly for that 6 to 8 months. There are some people, due to scheduling or because they want to be a little more cautious, they will do every other week, so bi-weekly dosing. But in general, we tell people 6 to 8 months, and they are weekly appointments.
So what makes someone a good candidate for OIT? And if so, how do they get set up for it?
So that's a great question. Really, anybody can be a candidate for OIT. The biggest factors to keep in mind when you're deciding whether or not to do this is the time commitment that it takes. And when you're done with the program and you graduate, you are dosing every day indefinitely. So that's something to keep in mind. There are some people who originally think they only are doing that daily dosing during the 6 to 8 months and then they're done. But the reality is they have to do it every day for the rest of their life. So that's one of the main things that I try to bring up with people, because the way the program works, again, it's 6 to 8 months, but you're coming into office, we're increasing the dose of that protein in office and monitoring you and then sending you home. And the other 6 days of the week, you're giving it at home. Then you come in again and we increase it. Then you're doing that at home. And we're just kind of moving up and up and up in dose amounts. So we've got to make sure that it's someone who can fit that into their schedule. Now, we have had people in our program who are high-level athletes. We've had people who are very busy in their jobs, and they all make it work, but you have to be committed to it. So if you don't feel like it can fit into your family's lifestyle, then it's maybe not a good option for you right now. Another thing is if someone, either the child or parent, is highly anxious about food allergy, that can be tricky. Because when someone is anxious, they can actually make their child or themselves become more anxious and cause reactions more often. And so if we're highly worried about it, then maybe it's not the program for them right now. And that's okay. OIT it's volunteer. It's an extra benefit that someone can have, and it definitely works. But the times where maybe it hasn't worked for someone is usually because they aren't able to make that commitment. They're nervous, or maybe their child just hasn't done well because of a myriad of other options. And so they decide not to do it or stop after they've done it. Our success rate, though, is high. I can't even tell you. I don't know. Over 11 years, more than hundreds of patients, probably into the thousands now, that we've successfully graduated from the program. How you get set up for it is you come in, you make an appointment with our office as a new patient. We will come in and do an evaluation. If you have had any testing done in the past, then we want to have that information if able to.
Yeah.
But I personally will have labs drawn that are current so that we can see in that lab work those IgEs of the specific food. We can have that written down as kind of our baseline numbers. Oftentimes, especially if we're talking about nuts, people will come in and say, I'm allergic to peanuts and tree nuts. I was told that when I was young. And we will check labs, and it's pretty obvious on those labs that they're actually not allergic to tree nuts or all of the nuts. And so we will do what we call an oral food challenge in order to get those foods back in the diet so the body can start to recognize those proteins and those chemical structures so that potentially you have an easier time doing OIT.
Yeah.
But getting set up is just coming in, making an appointment, saying that that's what you want to do. And then we have a whole set of appointments that you do to get started.
Does insurance cover it?
So that depends on your insurance plan. There are ways that it's billed. So your weekly appointments are billed as office visits. So it would be whatever your specialty copay is for that. If you have a high deductible plan, then you are going to be paying out of pocket for those visits until you max out. So that's something to keep in mind. There are a few other codes that we use, especially for your first appointment, that you would have to keep in mind. But when you come in for what we call a pre-day one appointment, or if you're just coming to find out, we actually have a fact sheet that we give you, like an FAQ sheet. And then we also have an insurance form that we have everybody fill out before they start with the codes that we bill so that they have an understanding of what they're going to be paying ahead of time. I would never want, anytime I practice medicine, I do not want anyone to come in and feel blindsided by a bill that they get. We try to be upfront about that. But that being said, I can't know what everybody's insurance covers. Right. So that's something that they can do or talk to our, billing or patient accounts department maybe to get a better idea.
It's good that you give them that information beforehand, though.
I mean, but you would hate to commit to something, and then has that ever happened to you?
Yes.
Think this spring I did something, I had no idea, and they're like, it's going to cost X amount of money, and I was like, what? I thought this was free.
Yeah.
So, we never want to surprise anybody with that. Also, a lot of people will want to know because like this time of year, we're getting close to open enrollment, right? So people are making decisions for their next year's plans. And so again, OIT isn't something you have to start right now. You can start at any time. We no longer have a waiting list. We can usually get people in pretty quick, but we do have patients that want to know. And so I'm like, great, go to your broker if you're using the marketplace or if you're choosing a plan from your employer. And you can say, these are the specific things that I need. And you can see what that coverage is so that you can make the best decision kind of moving forward.
Yeah.
So I'm assuming that each plan may be different for every patient depending on which allergy they have. So is that true?
For the OIT program?
Correct.
So it depends on the food that you're doing. We have protocols that have been kind of fine-tuned over the years. So they were written specifically for a certain time frame and kind of for the general public, right? For every patient. Over time, the longer we've done this, so again, for me, it's been 11 years. Over time, if we've seen patterns with patients where they've had a reaction at a certain dose, then we have changed and rewritten the protocol. So we try to be very conservative in that. Our goal is to get someone through without any reactions. We do provide emergency medications. We do have on-call providers just in case. So in that way, the protocols are the same. What's different is, your DNA is different than my DNA is different than your DNA. And I usually will tell people, I don't have a crystal ball. If I had a crystal ball and I could determine what would bother you versus what would bother you, that'd be easy. Because I don't have that, we stick to that standard protocol. But if during the program things aren't going well or something happens, then we will always kind of change and modify for that person. So we never go faster than what our protocol is, but we've definitely slowed it down or adjusted as we've needed to for different people. And then each food has its own protocol. And then if there's some that I've written in the past like year or two for a different food that someone wanted to do. So like green pea, I broke that down and wrote out a whole protocol for that. We've had 1 or 2 people successfully do that and it's been great. So we can treat anything, but we do have those set protocols that we're following and then we adjust to everybody as we need to.
I love this one. Really wanted to eat green peas that much.
Right? I know. There's lots
all the things.
Like chicken. We've had someone do it to chicken, shrimp. I mean, would you want to eat shrimp every morning? I love shrimp. It's one of my favorite foods.
I actually don't like it at all.
You got to be committed to it. That's the thing. You're going to be eating it every day, potentially for the rest of your life. So that's the heads up. You've got to know that that's going to be part of your life. But some people, especially across cultures, we have some people that it's really a big part of their culture. And that's amazing. We want to be able to have someone get in their diet what they want. And so we are happy to offer that. And if we don't have that protocol written, I'm happy to write one.
So can someone become allergic again after treatment?
If they stop dosing.
Okay.
So a lot of times we see this a lot in teenagers. So they've either done it as a child or they've done it as a teenager and they're not wholly committed. Then yes, if they are not dosing every day like they need to, they can become allergic again or have allergic reactions.
So do they need to redo that program again?
So I have had a few summers ago, I had 3 different teens that came in and it had been several months since they had dosed. And so they did come in. We have kind of a way that they'll come in and see me and then I'll see how much time it's been since they last dosed. And then we'll check their labs and see where their numbers are at. And then I have kind of my own formula that I use to figure out how far back we need to drop them. If it has been a significant time frame since they last dosed, then they have to redo it. Most of the time we can get it so like maybe they're halfway through and then we can go from there. But it's important. It's not just important because you've done the program, but it's important for safety.
Yeah.
I try really hard to reiterate that, especially with my teens and young adults. Like this, I don't care what you do. If you don't want to do this program, you are more than welcome to stop. I am here to facilitate what you want out of life with your healthcare. That's my whole point of a provider. That's what I try to do always, is to help facilitate care between, like, working together to maintain that care. The problem with this is if you're not dosing every day, you're putting yourself at high risk for reaction. So if strict avoidance, you can benefit from that and not, usually not having reactions. OIT, if you're dosing every day, you can also benefit from that and be able to freely eat and not have reactions. But if you're trying to do a combination of both, which is I'm not really avoiding my food, but I'm not dosing, that puts yourself at the highest risk that you can have. And that's what we want to avoid, bar none.
Well, thank you again for coming on. We really love having you, especially you're just so knowledgeable, and every time, like, I'm still thinking about our last, like, environmental allergy.
The dog thing, right?
Yes,
blew me away.
The dog thing. Just so many things. Like, I always learn so much from you, and I think if someone is struggling or has a family member that's struggling with a severe, allergy, I think it's totally worth their time to come and see you and get that figured out, whether, they want to do OIT or go another route. But
absolutely,
you know so much and you are so helpful. And I even learned stuff, and I don't even have food allergies, but I just think
it's important to be educated.
Yes, it's important to be educated, and where better to go.
Than the experts that do it every day.
The experts that do it. And I think people go to the internet a lot, and
that's my biggest no.
Yeah.
I tell people all the time, WebMD or Dr. Google is not your friend, especially with AI now. Like, AI has lots of great information, but it also has lots of misinformation. Right. Just because it was on TikTok does not mean it was true.
What?
So I legitimately get a lot of that. Well, I saw on TikTok, blah, blah, blah. That's fantastic. Social media can be fantastic. The internet can be fantastic. But the worst thing you can do is get your advice from the internet. And I've had lots of people have lots of problems because they've done that. We are always happy to help. We're always happy to see people. I love my job. I love the people that I work with. We can, figure things out. If you have questions or concerns, even if you're not sure this is the right place, come in. We're happy to see you and help you figure things.
That's perfect. So I would recommend, if you have questions or want to get things figured out, to make an appointment with her, and she'll get you good to go.
Thanks guys.
Until next time.
Yeah.
Disclaimer. The information shared in this podcast is for general informational purposes only and should not be considered medical advice. While our podcast will provide helpful suggestions and insights, every individual's health situation is unique. For specific medical advice, diagnosis, or treatment, please contact your personal health care provider.